practices that are aimed at better clinical outcomes while also focusing on individual patients' needs. Thirdly, we have Mrs. Suchita Gupta. Suchita Gupta is one of the emerging tech CFOs in the country. Her areas of expertise include advisory, transformation, and public engagement. A qualified chartered accountant, she is an alumni of Sri Ram College of Commerce, New Delhi.
At this juncture, I'll just request Shuchita, whose organization Care for Parents, and Pink Shastra. She's the only woman or panelist on our conclave. So, Shuchita, can we have you?
Yeah, thank you, Mohita. Thank you, everybody, for having me here. As Mohita shared, I'm the co-founder of initiative called Care for Parents. Like Amit shared, we are going to 170 million geriatric population, which is 60 plus by 2026. And even today, there are about 8 to 10% of the population is above that age, out of which 40% actually live alone. So me and my co-founder, Dr. Aman, we thought that why not start digitization and telemedicine for this particular group to begin with, because they're the most vulnerable. If I could share my screen. So like I said, Care for Parents is aiming to redefine the way primary healthcare, so preventive and assistive healthcare is delivered to the elderly, living all by themselves in India with their medical storage on cloud, with contactless devices, sharing, analyzation of information, because it is a sizable population even today, and the size is only going to increase in the coming years. If I was to just purely go and talk about telemedicine, which is the topic, as per WHO, this is the definition of telemedicine, and I would like to just touch upon the three basic things. One being distance, second is the use of information and communication technology, and third is the exchange of valid information for diagnosis, treatment, and prevention. So when we say use of information and communication technology, I think we're automatically covering the whole digitization aspect. And so what telemedicine has to do is cover all three aspects, so to say, and even the Ministry of Health has taken the same definition in the policy that they drafted in March 2020 regarding telemedicine. We may think telemedicine is new in India, but that's not true. It actually started in 1999. ISRO, the Indian Space Research Organization, actually deployed something nationwide. May not have become that popular, but as we all know, because of COVID, suddenly the use and adoption of technology has grown multifold, like shared with the previous speakers also. And India specifically, 68% of the population actually resides in rural area, which either has minimal healthcare facilities or none at all. And people have to either travel distances and even then not maybe have access to the kind of specialist that they're looking at. And WHO actually says that per 1,000 patients, there should be one doctor, 2.5 nurses, and 3.5 hospital beds. But what India today has is only 0.65 doctor, 1.3 nurses, and 1.3 hospital beds. So obviously the gap is huge, which can only be filled by telemedicine, and it has to be a joint effort by the government and the private healthcare institutions. So like I've shared, telemedicine is not video consultation only, which somehow has become the popular belief. It is definitely diagnosis, treatment, and monitoring of patients through use of technology, but it's also about the storage, collection, transmission, exchange of health information, and interpretation of patient data. Otherwise, if patient data is just sitting somewhere, it's as good as being on a paper, sitting in some cupboard in some corner of the room, if we are not analyzing it and utilizing it for better purposes. And then extraction from wearable devices. There are a lot of devices people are told to wear, customers, patients. And then in COVID times, we have these at-home self-use devices. If we can just extract this data and have it on a digital platform for not only viewing by the customer and the physician immediately, but for future viewing by anybody, then that is the excellent use of technology, as Amit said. And then obviously quick exchange of digital information via all these digital platforms. So definitely technology is the way forward. We all know that people use all kinds of apps on the cell phone. Again, in the presentation Amit shared, the adoption of technology is huge. So why can't we use such apps to control non-communicable diseases like diabetes, blood pressure, and so on and so forth? We can use it for various steps to ensure people remain healthy, enforce preventive healthcare, which is not so much the culture right now. So much so that CDC has actually shared in a report in US that chronic diseases are preventable with preventive healthcare to 75% of the nation's healthcare spending. And I'm sure if we did a similar calculation for India, the number would be similar, if not higher. And then obviously with multiple players in primary, secondary, and tertiary healthcare, physical data may get lost. So it creates complications, or if you're not able to find your reports, the doctor will ask you to get the test again, which is just adding to the cost of care for no productive purpose, really. So if we discuss about the benefits or the opportunities of telemedicine, it's huge. I mean, it expands access to quality patient care, especially the remote areas where, like I said, the other far and wide or non-existent at all. It is convenient access to medical care where people are on the go, like Shishir shared his experience. If you were to just pick up somebody from the house and take, probably by the time you reach, you missed your appointment. So telemedicine makes that happen. It's convenient for the patient and the physician to have access to a specialist, even though that specialist may not be in the same city or even in the same country. It saves time, especially in remote areas, traveling long distances. There's less expense involved. It maintains privacy. Like in COVID times, it helps in immunity because you're not coming in contact with people who have infections or diseases. It can also mean increased revenue for the physician or the hospital because they'll be able to see more patients in less number of time, and also better patient care in terms of follow-ups, reminders, because technology brings in both effectiveness and efficiencies. So where the interaction between the doctor and the patient is limited to that 30 minutes or 1 hour of consultation in physical, with technology, the doctor can have previous access to all the records and the medical history, the current medication, pre-known allergies, etc., etc. So then the interaction is much more quality that time that the interaction is happening, and then follow up later on. Currently, I don't see much follow up happening with the patient once he's left the OPD. We can also talk about challenges as far as India is concerned, and we can say there's a lack of infrastructure, internet connectivity, resistance to new technologies, and we can say that there's ignorance, lack of awareness, lack of regulations by the government. But we have all seen that change in times. The Ministry of Health came up with the telemedicine regulations on 25th March 2020 to bring in more formalization and rules and regulations in the space. And before that, everybody was skeptical whether we should, whether we should not. So, and now government is going to work more and more about these rules and regulations, so data protection policy and other policies that are required. So we're going to see more and more policies around this. So I don't see these challenges really lasting for long. As far as internet penetration is concerned, as of August 2020, the number of internet connections in India was actually around 760 million. And we know how much e-commerce has penetrated rural India. So why not digital healthcare? It's just that maybe not enough effort has gone into that space. And so if that happens, I don't see why telemedicine cannot become a habit. As it is, then we see there's an overload of information, whether it's search engines, or whether it's your neighbor, or whether it's the next door doctor. Everybody's ready to give you medical advice and whatever problems you're having. And so much like, I guess, the news that we see this day, we don't know which is the fake news and not, and people are developing bots to identify fake news. Why not have access to authentic and genuine medical advice when it is available through a platform with minimal effort? So, and that is what we are trying to do at Care for Parents. like the other players in the industry, like Shishir, Amit, and somebody else, where we have an in-house doctor who does a contactless onboarding for the seniors. We have a at-home self-use kit, which is sent to the seniors, and all the vital parameters are measured. The data is fetched onto the patient, depending on the, so we have access given to the kids and the patient. It's access-based viewing. And there's also digital tracking and reminders. And like I said, analysis of data, all these things that we are recording and even the lab tests that they're sharing with us, we are plotting them in the form of a list and a graph so that they can be compared as to what was and what is happening. And then on the basis of that, a video consultation with a specialist can be fixed. So where a physical visit can be avoided, why not avoid it? I think it's better for both the patient and the doctor that unless it's absolutely necessary, that physical visit to the healthcare institution or hospital does not happen, and things can be taken care of through a video consultation and prescriptions being uploaded and medicines and everything. But yes, if they still want to go at Care for Parents, we have dedicated relationship managers who help them with the paperwork and fast track services at hospital, because elders are most perturbed by this whole process where they have to wait, they have to fill paper after paper before they can actually see a doctor, and then the doctor will ask them questions, previous test reports, and sometimes they have it, sometimes they don't have it, and they keep sifting through their files and papers. So we make sure all this is available digitally on our digital platform. And so again, if it has to be shared, when we fix up a video consultation, either with a doctor on our panel or even for a doctor they want to consult, we share all this with the doctor before the actual consultation happens. We have pan-India tie-ups with the likes of Max, Manipal Hospitals, Global Hospitals, Paras, Venkateshwara Artemis, Shroff Eye Center, SRL Labs, Dr. Lal Path Labs. So as far as possible, everything can be done from home. Blood samples can be collected for blood tests from home. Physiotherapists can be sent at home. Nurses can be provided for 12 hours or 24 hours. Even dialysis can be done at home. And like I said, vitals can be monitored at home. So like I said, if we can avoid the physical visit as far as possible, I think we can save on cost, time, and everybody will be happier. So our motto, health for all. Thank you.
Thank you, Shuchita, for your presentation. Now we would like to have some kind of a panel discussion. I think we have Saurabh also and Vinitosh. Interesting thing that I observed was, we have this whole continuum. On one side, we have Amit and Shishir, who are conditioned healthcare professionals, moved from the digital space to the health space. And on the other side, we have the bubbling Ravi, who has just, finished his education and has ventured into an entrepreneurial venture. So the whole continuum is quite wide, and we have the entrepreneurial work happening, and at the other end we have Amit and Shishir, who have shared with us the use of IoT. And one of the things that we can look at is also the application of blockchains in supply chain, in the healthcare supply chain, wherein maybe. So any thoughts, Amit or Shishir, if you can contribute in terms of, the applicability and, why it would be more effective if we can have.
So, Mahitaji, I'll go first. Definitely in terms of if you're restricting it to the blockchain perspective, there are wide uses of blockchain, and we have done. Blockchain has not been an adopted technology worldwide, although some institutions in fashion and outlet and some of the exotic foods, etc., have deployed it. Here,
I think I read somewhere Eka is working on coffee board also. somewhere when branding and other things are required. But healthcare, I don't see many applications.
So in the life sciences space,
Yeah.
we have what is really important is that you enable smart contracts wherever there are biologics or the vaccines which need to be temperature controlled, and based on the contract, it needs to be reaching a point of sale, which is hospital, pharmacy, or an outlet with the clinician. If there's a temperature dips, it should be discontinued, and you should be able to see the ledger, right? It gives you information visibility right across, right from the sourcing of the raw materials for the manufacturer, production house to the supply distributions, for the pre-distributors to the packager to the retailer and to the point of sale. So, but in the blockchain ecosystem, all of these guys have to be on the blockchain. It can't be that one of them is missing and the other is available. There have been some challenges in it and actually deploying it. However, there have been many successful pilots in the biologic space, in the vaccine space, in the cell therapy space, where there have been temperature controlled pilots using blockchain being enabled. However, these are permissioned blockchains which are for commercial use, which is Ledger as a fabric, or even for the other consortiums that are completely owned. But however, Hyperledger is more preferred as a fabric. So how commercialization of this have been limited. However, in future, it is as digitization improves across the different downstreams from fleet management to the supply chain and retail, it will definitely disrupt, and you will see that price transparency, information visibility of stocks from point of sale to the end will be more visible.
So my only concern is, will this actually limit, say, supposing when we are talking of blockchains, usage of blockchains, um, uh, whosoever is using it, will that define the ecosystem for them, or in terms of, it would be a compulsion for all the members of the ecosystem to adopt it?
So if what happens is across the ecosystem, if it has to be adopted by all the key stakeholders, a distributor who is not taking it, then I do not have the information visibility of where the stock is, where my inventory is, where my critical stuff is, and all of them have to be abiding by the smart contracts. Similarly, when you look at digital health, there are multiple health records that have been inundated by block. It's being used. However, the nodes are only defined to the doctor and the patient. Unless you build the entire ecosystem, which includes the regulator, or follow what Lithuania, Georgia, and other countries have done, where there's a pan-nation model whereby I'm able to subscribe my unified ID, leveraging digital health and the blockchain, and unifying the medical records across the entire ecosystem, so that you see what information is there across the visibility, which is what I talked to you about, the NDHMA. Then it's substantiates. So everybody has to be on the blockchain ecosystem to make it successful.
My question is to Ravi, of course. Ravi talked about personalization of healthcare. Traditionally, healthcare has been designed to treat population so that the cost can be minimized. So there is actually a dilemma with personalization or going for population-based care. So how digitalization can solve both problems? Means going for personalized care as well as keeping the cost low also.
Yeah, thank you so much, sir, for the question. So I take it as two different things I wanted to share, sir. If you are building something, the value proposition and the customer segment should be matching. So there is proper healthcare is still a problem. Yesterday I was reading some blog by Kunal Shah thread. So he was very clear that only 25 million Indians are of the affluent class, and the rest of the people, they are not even earning more than 50,000 or 60,000 a year, right? So the healthcare challenges of various economic sectors are different, and some chronic, some health issues really need a personalized care. And if you're building a personalized approach, like a data driven, a lifestyle product or something which has a lot of personalization. And obviously, some set of population is not able to use it. It is not meant for them. So we should I think segment the population and devise the solutions according to one's own needs and challenges. One size doesn't fit all for such a huge problem, I personally feel.
Yes.
Amit, you wanted to add something to the previous. You are on mute.
Am I audible?
Yeah, yeah.
Yeah. So as Ravi rightly mentioned, I think one solution doesn't fit all. So, means in terms of even those personalized medicines, when we are talking about, there are some sort of diseases which in which these kind of personalized medicines have a life-saving impact. Means in those scenarios, probably means unfortunately that's a fact of the matter that many people won't be able to afford. But for even one person who is able to afford, it's a life and death situation for him. So we see this kind of scenario where some of the patients who come in the cancer hospital, specialized hospital, and they have the means and resource of going on some high-end test gene markers, and based on that, when the therapy is being advised, it's like it's like a bullet directly on cancer. I mean, you can't expect anything better than that, which is as comparable to the Memorial Sloans or the Sloan Kettering Anderson Institutes out there. In India, we are delivering those. So unfortunately, cost is a factor, but at the same time, it has to be it's a market dynamics, and sometimes when somebody have a solution, I think then there are means to find a solution. I mean, there are nowadays there are a lot of channels to even provide the support if somebody can't afford a treatment. But in this scenario, I think we should move ahead still in the personalized medicine area.
Shuchita, I just at this moment I would like to bring in Shuchita. What was your experience in terms of the regulatory challenges that you think telemedicine would face, and how your company is resolving that?
So, like I shared, Mohita, thankfully the government came out with telemedicine rules in March 2020. I don't know how many of us know, but before that, there's actually been a case where the judge held that the doctors will be held responsible because one of the line of treatment they took with the patient was video consultation, and unfortunately the patient didn't survive, and the kin actually sued the doctors. Because till before March, it's not acceptable as a formal way of treating a patient. And so, because the doctors adopted it, they were actually punished for it. So, adoption of telemedicine and e-pharmacies has become far easier and regulated with these rules in March. And with the data protection policy also coming in soon, we see that the adoption of digital healthcare will increase. And I think all of us should take advantage of this situation where, yes, COVID unfortunately has forced us into it, but how do we not lose the momentum post-COVID and make sure that the benefits just spread far and wide and not stop right here?
Yeah. So, yeah.
Yeah. One more question is there. They came up with 25th March, I guess, in 2020 with the guidelines, and very hurriedly they did that. So, what are the major drawback of that guideline provided by the government? And another question is, have they given different guidelines for different type of disease? Like telemedicine may be better suited for chronic care, or the care for elderly people. Home care is more suitable. So, has they given some guidelines for disease-specific guidelines also in that telemedicine guidelines by government?
No, like you said, it was a little at the spur of the moment kind of a thing. So where they tried and cover most of the things, it still has to be refined more to cover the specific aspects. And all it does is it says that one, it is acceptable to do video consultation and write a prescription basis on that video consultation and upload it on a platform. They have not got into the specifics of where what is suitable or not suitable. So they're not really suggesting what is suitable or workable in any one condition or not. And like I said, the government still needs to work more and refine it much more to be very specific to chronic diseases, non-communicable diseases, preventive healthcare, and so on and so forth.
And another question is, in some states, even Ayurvedic doctors are permitted to practice modern medicine, and in some maybe the condition will be opposite. So suppose some person takes telemedicine consultation with a person whose company lies with in a state where Ayurvedic doctor is allowed to practice modern medicine. So how to handle that kind of situations?
I would say it will depend on the owner of the digital platform, what you're communicating to the customer. See, if the customer consent is taken and the customer knows that they're actually consulting with an Ayurvedic doctor and not a registered medical practitioner. So actually the telemedicine rules are only applicable to RMPs, which is registered medical practitioners. And that's why you see this whole new movement where Ayurvedic doctors are wanting to be counted as RMPs. As of today, they are not counted as RMPs. And so telemedicine rules actually don't apply to Ayurvedic doctors.
Oh, thank you.
So any updates regarding the technology adoption for the cancer system, sir? So the technology like IoT or technologies like the advances of telemedicine has encountered or being utilized in the cancer treatment. Amit, sir?
I'm sorry, I'm not able to hear your question correctly. Can you repeat the question again?
Yeah. Any illustration on the technology adoption like IoT or maybe the digital twin like technologies where we can actually advance our the cancer treatment performance. Any updates on that side from your end?
So, say as I mentioned to you, one of the important aspect of or utilization of digital assets is the tumor board utilization. I mean, where, as Shuchita also mentioned, I mean, by virtue of using some of these platforms, the doctors, and it's not only the access to the patient, it's actually the access of the best-in-class specialist to another doctor, where they want to discuss the case out there. So that is something which is being done. In terms of the Internet of Things, or rather the data, say cancer is I mean, the research in this landscape of cancer globally is anyway very high, and most of the super specialists are very well connected within their own networks. And unfortunately, still the super specialists of the country, which are the people who had practice of more than 25-30 years of experience, they are not that much good on the entire technology side of it. So they are giving input to some of these studies or systems out there, but the exact utilization, just I'm yet to see. But digital platforms obviously is something that we have really seen in last 1 year utilization.
So similar to what Ravi is working on, maybe the pregnancy and mobile app, similar to cancer treatment and mobile communication and mobile app development. Ravi,
see, what happens is, unfortunately, cancer, unlike many of these lifestyle and some of the maternities, is a very happy thing where the patients and doctors are also comfortable in kind of discussing many of these things in platforms or the apps. Cancer, unfortunately, is not an easy disease to manage on a continuum of care, because as the disease progresses, first and foremost, there is a lot of stress in the system which comes in the family, and then the doctors are also sometimes it's not a single disease actually. Cancer, if you see, it's itself a multidisciplinary approach is required. So most of the time, the initial consultation is done on a platform, but then and lastly, which is again very important question, is if you see even the telemedicine guidelines, it very specifically mentions that no cancer drug can be prescribed using a telemedicine platform or a platform itself. So at this juncture, I think we are a little far away from practicing or seeing the benefits for the cancer
Cancer or acute.
drug or maybe any advanced stages of cancer. But then at the same time, in the end of life care scenarios, where some of these consultations become important, including the psychological consultations, the diet consultations. There again, technology plays a lot of role.
Right. Ravi, your end?
Yeah. So, hello.
Yeah, Ravi, you are free.
Yeah, Saurabh, you asked a very interesting question. Like Amit was saying, cancer being a very different domain altogether. One interesting insight I would like to share is there is a startup which I heard is solving this problem. So they are radiation oncologists, medical oncologists, surgical oncologists, right? So which type of oncologist is right for that particular, cancer is something which is challenging for patients to understand. So there is one startup which is solving that problem. Technology and innovation again problem specific for this particular disease management. I heard this was the biggest problem. I'm not an expert to comment on it, and that problem really onco.com. And coming to pregnancy is such a physiological state where our company provide a lifestyle program, digital life health program, a lifestyle program, which will help in expecting couple to follow a healthy and happy lifestyle for the future baby. So this is what we do, and similar approach can be followed by other chronic disease management like PCOD,
Diabetes.
PCOS, diabetes, and all for women health as well. Mental wellness is very underrated. I mean, not given much importance. So right from fertility to menopause, each key life event of women is very challenging. So a specific key milestone or key event of life or a chronic management, I think this model will play a huge role. Today, Calm and Headspace, they with their generalized mindfulness approach, they have built a big solution adopted by millions. So why can't that be a personalized mindfulness solution? Catering to each key life event. So that is what came us to our.
Right. Thank you. Thank you so
Ravi,
much.
one more question is, can a mobile app company which is having the patient data and they means de-identify that data, means remove the name field, can they monetize that data or use that data for other purposes? That is a big concern of the actually end user.
Right. Sorry, Vinay sir, I'm not getting your question. Can a mobile app data monetize the patient data without the name?
Physiology data, vitals you are having, habits you are having, but you remove the name from there. And can you use that data for other purposes also?
Personally, I think I'm not the right person, Vinay sir, because we don't monetize the data of the users. So if it is with the name or without name, I don't even know how do we monetize it. But each company,
I think that is a
The gap area.
problem everywhere.
Yeah.
And more so, yeah. So, Shishir, Amit, Shuchita, anybody else who can, are they regulated?
So I can't name the organization, but I can tell Professor Mishra that it is done. But even in the public domain, I can give you an example. There is a company called Variant Medical Systems, which has bought an oncology network hospital in India last year, and you will be surprised actually the valuation of this entire hospital. One major chunk of that particular hospital valuation was due to the data that the organization carried, because they were able to actually use that particular data in some of their own developmental work as well as some of the other commercial activities. So in short, the answer is definitely yes. as long as they de-identify the data, and also how they would have actually managed at the time of data acquisition, because many organizations now they actually get you signed a consent where there is a so-called consent signed that de-identified data can be shared for some of the activities.
Right.
Shuchita, you wish to add to that?
Right now, I don't think there are any regulatory policies or guidelines regarding that. But I think as far as ethics are concerned, it would be very unethical to monetize the data unless, like Amit shared the example, you have been acquired by a company which sees your value more in the data that you have than anything else. Then it's something different. But otherwise, I would say it's unethical, personally speaking.
Yeah, I completely resonate with Suchita's thoughts. A lot of data, a lot of user behavior companies are definitely using to make the user experience better, but monetizing is definitely unethical.
Yeah, I think before closing, any students, if you have any questions, they can write. Or any Shishir, if you wish to add something.
I think Amit summed it up very well. There are the de-identified data where you remove the PHI has been used across the board, although it's unethical, and not only in India, worldwide, by life sciences companies, by healthcare companies, by banks, by financial institutions. And when I say financial institutions, bank, this is all
Insurance.
healthcare data, including insurance, the BFSI sector, including the de-identified PHI. So you de-identify the PHI, the data has been used and monetized. So if your question is, has it been used? Yes. Is there a regulatory framework that can actually close this? It can be done. There are GDPRs and other restrictions. However, still there are ways to circumvent and move out, like what Amit was telling about how one company took over and ethically raised its valuation by using it for better enhanced outcomes. So that's the way it's been done.
Yeah. So I think we had an interesting series of panelists, and very brainstorming session was quite. I think it would be useful for the students. As Ravi Teja was saying, we can do our best in terms of delivering the best information to the students. It's up to them how much they absorb. That is another challenge of that all of us are facing, and we on our part are doing our best to bring the most relevant things to be discussed for our younger lot. And healthcare and supply chain are two things that have have been the most challenging things in the past 9 to 10 months. And telemedicine is one thing which has taken which has actually it saw the opportunity, and people have taken that bandwagon and they are on it. So hopefully as Shuchita also said, that the momentum should not stop post COVID, and this would also require more of a psychological change of mindset also from individuals. And hopefully the beginning has been done, and eventually people will take on to it. So we stop this session here, and I think both the days have been very fruitful for all the students and the professionals who were associated with it. Thank you so much for joining us. Yeah, over to Vinitush.
Yeah, now officially I am supposed to give the vote of thanks. So this 2-day conclave was very fruitful, I guess. And as in Sanskrit, one sloka is there, Vai kriti vardhati eva nityam, means this is the education. If you share with someone, it actually increases. So I guess it was equally fruitful for the as well as participants as well as speakers with their discussion. I guess they have learned a lot, or they were able to pick some new things. So formally, ladies and gentlemen and my dear students, it gives me an immense pleasure to deliver this vote of thanks for the 2 days long supply chain management conclave. And first of all, we want to thank our chairman, Dr. BBL Madhukar, and directors, Sri J.K. Das sir, for giving us clue to organize this conclave, and from there, our Professor Mohita picked up and organized it so beautifully with the help of the other member of COSCM, Center of Supply Chain and Operation.
I think.
And I would also like to thank all speakers for taking time out from their busy schedule to share their thought on the issue related to healthcare supply chain. I would also like to thank all participants for attending the conclave, our students for being there for last 2 days. I would also like to thank our IT team, Mr. Neeraj Joshi and Mr. Anush Sharma, for providing the excellent support. And there were some glitches, but they managed that very beautifully. In the last but not least, I would like to thank the team FOSTRA and our students for successful organization of this conclave. And thank you. We will see similar type of events in near future also from COSCM side and FORE School of Management side. And thank you very much for joining this event. Thank you very much.